I am Dr. Mallikarjun, Dr. Malik, so intensive care specialist. Today I want to talk about an important topic where the high heart rate, there will be a sudden high heart rate. Till that time the heart rate will be normal. Suddenly the heart rate jumps to, normally it is 70 to 80. Suddenly it will go to 170, 180, 200 like that. Some patients will have this habitually, occasionally they will have this problem, but for some patients this is the first time. So they will have, this is called supraventricular tachycardia. Supraventricular tachycardia. This is called supraventricular tachycardia. Till that time the patient is normal. Suddenly the heart rate jumps up very high to 170, 180, 200. The patient will have sweating, little breathlessness. The patient will be breathing like this. So little breathlessness, tachycardia, these two, and slight sweating, these are the symptoms. Most of the times the patient complies, says, when you take the history of the patient, they come to the ICU, they come to the emergency, to the hospital. When I attend them, they usually, when I ask them, they say that this happened once or twice before also, but after 2 or 3 minutes or 5 minutes it subsided, or half an hour it subsided. I just took rest, it subsided. But it is not that case every time. This is supraventricular tachycardia. The heart has got 4 chambers. Lower 2 chambers are called ventricles, upper 2 chambers are called atria. Okay, so this is above the ventricles. There is an electrical supply, something like an electrical wiring of the home. There is an electrical supply. What is ECG? What is electrocardiogram? ECG means, this is ECG. What is ECG means? We are recording the electrical activity of the heart. So there are some electrical points like atrioventricular node, sinoatrial node. There are some nodes in the heart. Between that there are some fibers called Purkinje fibers, etc. So this is the subject. Forget about it. I am talking about the condition where the patient lands in emergency medicine and ICU with high heart rate, sweating and breathlessness. This is very, very, very important. Immediately we put the patient on oxygen and we give them injection adenosine, and sometimes injection cardarone. And if the adenosine, cardarone, these two don't work, usually it subsides with injection adenosine. If it doesn't subside with these things, then we may have to do defibrillation. That is called cardioversion. You know, defibrillator. On the chest there will be 2 pads, we apply it. So this is called, a machine will be there called defibrillator. We do cardioversion. There is little difference between cardioversion and defibrillation. In cardioversion we use less power. That means 100 joules like that. So immediately the heart returns back to the normal. So why you should do this? Because if the heart, this is a normal ECG pattern, even in usually 70 to 80 is the heart beat. Usually 70 to 80 is the heartbeat. If this goes on, if the high heart rate about 170, 180, 190 per minute, if the high heart rate is going on, but anytime the patient can land in arrhythmias. Arrhythmia means irregular heart. The heart beats normally till that time 170, 180 also, that it is regular. But suddenly if you don't treat this patient, it can go into irregular, because if the heart becomes irregular, that is called arrhythmia. Arrhythmias are very dangerous to the life. It is life-threatening. Sometimes the heart can stop immediately, or he can go into cardiac failure. So these are all the complications. So please, whenever you have high heart rate and you are able to hear your heart at a high speed, very high speed, like 170, you can count. It is very, very high. It is very, very high. And if you are sweating, if you have little breathlessness, don't sit at home. Come to the hospital, immediately get treatment. This is an intensive care treatment. And one thing is, after this, once the heart rate comes down, we hand over the patient to the cardiologist. He will do 2D echo, etc. tests and rule out any underlying pathology. Is there any pathology in the heart, or without any pathology it came? Even without pathology, if this problem comes, further attack you can prevent by giving some medicines. By giving some medicines, you can avoid a further attack. So this is very, very important. Don't neglect it and immediately come to the hospital. That is my request, because there is very good treatment for this. Cardiologists, we can easily prevent this.